Good morning, everyone. I'm Suresh. I'm the convener of this two-day virtual international conference on update on stem cells, academic and industrial perspectives, future challenges. Welcome to one and all. Just a brief remark about the event. We have scientists from the USA, Europe, and India participating actively and delivering lectures. As on date, we have over 300 registrants who are going to participate, and a couple of instructions for the registrants. In order to be eligible for the e-certificate, you need to attend at least 5 sessions, including the inaugural, and you need to fill out the feedback form, which will be circulated either today or tomorrow. Without much ado, I'll hand over the session.
Just a small announcement. Our chief guest has also joined. I have made him the co-host. Happy to have you, sir. Dr. Krishnamurthy Kannan.
Thank you so much for the welcoming. Yeah.
Good morning to all of you. Good morning, Dr. Anand Srivastava. It is my pleasure to introduce Dr. Anand Srivastava today for the first session. He is the first speaker of the first session, and I will give brief introduction of Dr. Anand Srivastava. And he has been associated with leading universities and research institutions of USA in affiliation with University of California, San Diego Medical College, University of California, Irvine Medical College, Salk Research Institute, San Diego, then Burnham Institute for Medical Research, San Diego, then University of California, Los Angeles Medical College, USA. He has developed several research programs, and he has an extensive research experience in the field of stem cell, which is documented by several publications in many peer-reviewed scientific journals. Dr. Srivastava is the chairman and co-founder of California-based Global Institute of Stem Cell Therapy and Research, GIOSTAR, headquartered in San Diego, California. The company was formed with the vision to provide stem cell-based therapy to help those who are suffering from degenerative or genetic diseases like Parkinson's disease, Alzheimer's disease, autism, diabetes, heart disease, stroke, spinal cord injuries, paralysis, blood-related diseases, cancers, and burns. GIOSTAR is a leader in developing most advanced stem cell-based technology, supported by leading scientists with the pioneering publications in the area of stem cell biology. Company's primary focus is to discover and develop a cure for human diseases with the state-of-the-art unique stem cell-based therapies and products. The regenerative medicine provides promise for treatments of diseases previously regarded as incurable. So with this brief introduction, I would like to request Dr. Anand Srivastava to start his speech.
Thank you very much, Professor Das. I know this is, and good morning everybody, because this is good morning in India. And of course, I'm in San Diego, California right now. And can you hear me clearly?
Very clearly.
Yes.
Very clearly, sir. I would request all other people to switch off their video. Only let Dr. Srivastava to have his video. That will help the YouTube video recording and getting that.
Wonderful. And thank you very much, particularly Professor Suresh and Professor Das. And I know it's so difficult during the time of COVID to organize such kind of conferences, and particularly when you are dealing from India to abroad, like international, the time zone and all these things. So it's so difficult to really manage and organize. So certainly needs a lot of courage and dedication. So I really feel very thankful to Professor Suresh and Devashish, you to managing all this complex algorithm for Zoom and making everybody available can see, recording all these things. I'm here in San Diego, and this is Global Institute of Stem Cell Therapy and Research, that is GIOSTAR. And Professor Das already told about all, in fact, too much about me and GIOSTAR. So our aim is to develop treatment or therapies related to stem cell science and degenerative diseases using regenerative medicine. And this was actually, we formed this institution in 2008, almost 12 years back. And it's very interesting story. And quick, actually, I started working on stem cell science at University of California, San Diego Medical School in 2000. And in 2000, this modern stem cell science was not very much known. Of course, bone marrow transplant and hematopoietic stem cell transplant, entire world, including US, was practicing and is practicing last 40 years almost. But this concept or this idea using the stem cell to manage different kind of diseases and degenerative diseases or repair the damaged organ were not very much in practice. So I started working at University of California, San Diego in 2000, like 20 years back. And before that, I was interestingly working on the gene therapy concept because human genome program in 90s. And so entire concept of human genome program was that if you know the correct gene or gene sequence of the humans, you may change the defective gene with the correct gene. So you may treat almost each and every metabolic disease practically, means theoretically. Yes, it is very complex. And I'll come, it's very interesting that today we are using almost a gene therapy kind of thing to counter this COVID-19 virus. So I showed in 99 that yes, we can change pancreatic gene with correct gene and it can be expressed. But, and I also showed that we can deliver tissue targeted gene. So a lot of things I showed in 2002, 3, 4, but gene therapy is really very complex. And so I was continuously thinking what may be the easy way to manage this particular problem related to metabolic degenerative diseases. So that's what I started culturing the human embryonic stem cell. That time it was embryonic stem cell. Now we are using adult stem cell, particularly the mesenchymal stem cell. But that time everybody started working on human embryonic stem cell. Then California Institute of Regenerative Medicine was formed. We fight a lot, in fact, and we fought. And 2004, California first time accepted officially to work on stem cell science against federal government and funded $3 billion to work on the stem cell science. So that's the way I started working, and then I showed that damaged brain can be repaired in 2005-06. So today, if we see the real problem, when the COVID problem came in the picture, and if I remember correctly, when President Trump was visiting to India in February, in fact, nobody was thinking that COVID is such a big, or going to be huge problem. But when President Trump came back to US, and after that in March, it started the news and all these things that it's going to be a huge problem, and almost 77 million people infected right now. And in US, almost more than 300,000 people died. In India also, almost 150,000 people died with COVID. But now India is doing very well, in fact, managing the COVID in comparison to our country here. US, I can say, because the recovery rate is very good in India right now. So saying all these things, when it was flaring up and nobody was knowing how to manage it, I'm talking March of this year, nobody was thinking really what is going to happen. And of course, there was only one way people were discussing: to manage your immune system or develop the vaccine. Developing the vaccine was going to take a lot of time, and we knew it is going to take a lot of time. So being a scientist, and of course I get my education in Banaras Hindu University, and the philosophy of Banaras also inside me, that, okay, you have to keep thinking out of the box. If you are going to face some challenge and there is no answer, then really you have to think how I can counter this. And fortunately, as I told, that I was working on stem cell science, and I used particularly this mesenchymal stem cell a lot to manage the autoimmune diseases and other kind of immune-related problems. So then I started thinking, is it possible to really utilize the character and ability of mesenchymal stem cell, which is well known to manage the immune system and imbalance of the immune system. This is also well known to suppress the inflammatory cytokines and the inflammatory gene actions. And well, these all are well documented. And then very same time, I think in April this year, one wonderful paper came from China, and of course China, Russia, and several countries collaborated, Poland, Brazil, US, and they published a paper that in China they managed a severe COVID patient, not one, but I think 6-7 severe COVID infected patient using the mesenchymal stem cell. Then that was the light actually in the tunnel, and I was continuously thinking in that same direction. Then I immediately talked to US FDA that till we really have any logical way to counter this virus, why not we should try to use mesenchymal stem cell, which is quite safe, because safety and efficacy of mesenchymal stem cell is also well documented in animals and human models. So I thought, and I wrote to US FDA that why not we should use mesenchymal stem cell to counter this cytokine storm created by this virus. And we know this particular virus, that is SARS or COVID-2 virus, COVID-19, is when it goes in the body, it creates very strong cytokine storm. And of course, then it's a lytic cycle, and then it kills the cells. It creates a lot of problem with the lungs, and the water fills in the lung, then oxygen exchange problem comes, and a very severe respiratory syndrome comes out. So let's see, entire idea which I wrote to FDA, and then finally FDA approves, and I'm going to say deal one by one all these points. So you already talked about this. These are the institute where I worked, in fact. So we know that this COVID-19 virus, basically, so attach with its S protein. We know this is RNA virus. This is a double bilayer envelope, bilayer fat lipid layer, and then RNA, and then it has a membrane protein, S protein. very well and very known S protein, the scariest protein of this virus is well known. Everybody talks about S protein. So what it does, it binds with the ACE2 receptor of the alveoli of the lung, and that is epithelial. And particularly this bind to most of the time the alveolar type 2 cells of the lung, and then insert its gene inside the cell, and then mRNA start making the particular protein, and then it's the lytic cycle, so it ruptures the cell and comes out and multiplies. This is the way this virus works. So it is well known that mesenchymal stem cell, which is a kind of adult stem cell, and the beauty of this mesenchymal stem cell, it is available in the fat cell. You can take out from the fat cell. You can get it from cord blood, peripheral blood, bone marrow. So this is very ubiquitously present all over the body, in fact, and very easy to isolate. Then second biggest character of this mesenchymal stem cell, that you do not need to match it from one person to another person. That is the another beauty of this cell. So basically you can generate these cells in the lab without any problem, and you can take from one person, donor to host, and you don't need to worry about GVHD, graft versus host disease or rejection of these cells. So quite easy, and you don't need any complexity. You don't need to really manipulate these cells, and these cells are well documented for its character for immune modulation and immune privileged situations. So what we see that this mesenchymal stem cell can really suppress the cytokine storms. So you see what it does. Can you see this this side, the photograph?
Yes, yes.
Okay, so this is mesenchymal stem cell, and it suppresses all the bad cytokines like IL-6, IL-10, and then second, it increases the IL-10, which is good cytokine, and of course suppress TNF-alpha, IFN-kappa, IFN-gamma, and all these inflammatory gene and cytokines actions. So this is in fact, and these kind of the cytokine storms are well known when COVID-19 infect a person. So the whole idea was not to kill, because there was no medicine, nothing was available that particular time, and still, like vaccine just came 3-4 days back, and still people are undergoing for vaccination. But before that, the best idea was to somehow neutralize these inflammatory cytokines. So once these inflammatory cytokines are neutralized, then the effect of this virus is neutralized. So even the virus is inside the body, the effect is not there. And then second best part, so when we inject the mesenchymal stem cell in the human body, and if the virus is there, then first step, it goes and neutralizes all those inflammatory cytokines and gene actions. So those are neutralized. So person does not feel the effect of the cytokine storms. Then second, this particular mesenchymal stem cell has parakine activity and secretes those molecules which enhance the regeneration of the damaged portion of the lung, and also manage the fibrosis of the lung. So we see once it is the person was treated using the mesenchymal stem cell, all these cytokines is decreased. So we could rescue the patient, and I'm going to tell our results. So these are the detailed results, which I think just the data, showing that how it works. The most important thing is this, okay? So this is the CT scan. So if you see the virus infecting the lung here, so its score is quite high. So we transplanted here the stem cells, mesenchymal stem cell. And this is the score the virus or virus infection or loading of the virus, titer of the virus in the lung. And if you see, after 1 week, the lung started clear. And the patient really got rescued from the COVID-19 infection. So this was so good to know that COVID-19 situation may be cleared or managed using the mesenchymal stem cell. So this was the idea, and then I wrote to the US FDA, and as you know that US FDA is very, very quick in that sense, and I really thanks to them that they immediately approved emergency compassionate use of the mesenchymal stem cell, so we can use this mesenchymal stem cell to treat the COVID patient. So we are one of the most big pioneer institution in US to get this approval from US FDA to treat the COVID patient using mesenchymal stem cells. So now I will come on very interesting. So this was the part of the mesenchymal stem cell using the for the treatment of the COVID-19. So of course we are under the process of treating several patients. We treated very severe patient who was under coma for almost 60 days because of this COVID infection and ARDS, that is respiratory distress syndrome, and he came out, and now we are under the process of treating several patients. So the idea was to how to suppress or neutralize the COVID-19 triggered cytokine storm in the patient. And I would say that we quite successfully achieved that using the mesenchymal stem cell. But the point, again, a stem cell, it's complex. You have to manage the stem cell, and then it has to be in good quality and all these things. So bringing to the masses and treat the masses may not be very easy using the stem cells, because you need a particular kind of infrastructure and the trained clinician and doctors. So certainly this cannot and may not replace the vaccine. So till we were waiting for the vaccine, then this is, I can tell this is one of the most effective way to manage the COVID-19 infection. So now the vaccine is in the picture, and a lot of questions and anxiety and enthusiasm related to the vaccine, and this mRNA vaccine, and Pfizer, of course, Pfizer made it, and AstraZeneca made it. So it is very important for us to know, and I think viewers may like to know, how really this vaccine works, that is mRNA vaccine, and why it is important to store at minus 70 degrees centigrade or minus 20 degrees centigrade, which is also a big infrastructure problem for developing country, and even in the advanced country, because you have to develop really very strong infrastructure to store this vaccine in minus 70 degrees centigrade and transporting this vaccine for several places. So let's see, and I would like to show my viewers how really this vaccine works and what are the difference between this Pfizer vaccine and AstraZeneca vaccine. And this is very interesting, one thing, and I'm very encouraged, in fact, because indirectly, this both vaccine are working on the basis of a kind of gene therapy mechanism. So let's see how this mRNA vaccine works and what's the mechanism. So I'm just first going to talk about Pfizer and Moderna vaccine, and this I made immediate because the vaccine just came and the mechanism and all these things. So I just sketch And of course, I took all this information from available on the studies on the journals and YouTube and Google and all these things. So I just want to make clear this is not 100% my idea to show the mechanism. It is all available on the internet and all these things. Just I'm trying to summarize for the viewers. So this is the basically. So what they did, this is the virus. Okay, this is the S protein of virus. So they made a sequence for mRNA which is coding to S protein. Okay, and they surrounded this to lipid nanoparticle. And this, because mRNA, so mRNA we know very fragile, okay? It is so easily digested by mRNA, and mRNA enzymes are available means in the dust everywhere, okay? So it's very, very fragile. That's what they are storing this in the -70 and keeping away from all kind of problems. So to make it very stable. So this is mRNA. And so they made a lipid nanoparticle with this mRNA, so it can go to cell, host cell. So and this mRNA, the beauty of this mRNA which they made, it is not entering in the nucleus of the cell. So when it is not going in the nucleus, it is not integrating in the genome of the cell. So that is the best part which they are telling, and that's a lot of curiosity also whether this is mRNA and if it may integrate with the nucleus and it can change the genetic structure and all these things of the cell and human being. So it is not like that, okay? So this mRNA is going to this cell cytoplasm. Of course, this is ribosome, this transcribes the S protein. Then it expresses on the MSC surface receptor and make antigen here express, and then this T helper cell comes and bind with the T cell receptor with this and start making the cytokines. And this also expresses the B cell, macrophage, and dendritic cells. And then this triggers the B cell proliferation, and then it makes plasma cell, and then plasma cells makes the antibodies, which goes and bind to virus and neutralizes it. So this is the entire mechanism. Here the MSC measure histocompatibility complex H1, and that is also bind here and produce the cytotoxic cells, which creates the cytokines. And if the virus is going to attack here to this cell, COVID-19 after the vaccination, this cytotoxic T cell can kill this host cell as well, but not till the virus infect this. So this is the mechanism of particularly this mRNA vaccine, which Pfizer made. So here, what are you doing? Here you are inserting a foreign gene in the shape of new mRNA, that is a nucleic acid, to the host cell. So you can say this is a kind of gene therapy, and now they are telling that yes, it is very safe. So the point is here that how the human genome program started in 90, and the idea was to sequence the human gene, and so you may change the defective gene with the correct gene. And if you know, recently Professor Chris Murthy is, I think, interested in hematopoietic stem cells. So he may be knowing that they treated sickle cell disease, transferring the disease here, and this New England Medicine Journal just published that paper that they use the beta globin gene to transfect the cells, hematopoietic stem cell, and infuse to the sickle cell disease patient, and they rescue those patients. So now they are coming on the point that yes, you can do you can use the gene therapy basically kind of here to counter the virus. So now come on this AstraZeneca Oxford vaccine. they are in fact one step ahead from the Pfizer. Okay, so they use the DNA vaccine actually. So DNA is little better stabilized molecule, so it does not disintegrate as quicker as mRNA. And here they are using the adenovirus. There they are using the fat nanoparticle to wrap the mRNA and deliver in the cell. Here, this AstraZeneca is using adenovirus to inject the DNA, that is genetic material again. So now you see, this is opening a very new chapter in the field of medical science, because last 30 years, starting from 19, I know I was working on gene therapy, and as I told in 1999, I showed first time that you may insert pancreatic gene to correct the pancreatic gene, and you may express that gene in proper manner. But we could not do the gene therapies for several diseases, and it's very difficult to get the approval to do the gene therapy because you use the virus vectors to deliver the gene in the cell. But COVID, because of the COVID-19, they allowed this adenovirus to, and now they are going to vaccinate every single person. So it means they are going to inject this particular vector to everybody to use the DNA vaccine. So this DNA is, of course, going to nucleus, okay? In that case, it was just lying in the cytoplasm, that mRNA. Here, the mRNA is not, this mRNA is not going into the nucleus of the cell. It is just directly going to ribosome and thus translating the protein. Here, this DNA is going to nucleus. From here, of course, they are not going to, they say it is not integrating to the genome, but they are transcribing the mRNA, and from that mRNA is the same mechanism, B cells, plasma cells, and making the antibodies for the virus to kill the virus or neutralize the virus. So the point is, because this adenovirus and secondly, that nanoparticle, fat nanoparticle, these two things are going to go in almost, I will say, at least 50–60% of the human being. And that would be extraordinary data. And if this adenovirus successfully, which data is telling it is very successfully transcribing and translating the particular protein. So now using the same adenovirus, because now it is allowed, okay, to use in the humans and at a very mass level. So using the same adenovirus, you may pack any kind of DNA or gene here to deliver in the cell to treat several kind of genetic diseases. Of course, that need a lot of other researches and a lot of other complexities are there, but using the viruses to deliver a particular gene is now here. We are doing it for thousands and thousands of the people. So that is the best part. And why this AstraZeneca does not need -70, they need just -20 because it is DNA. So it is more stable, so you don't need -70 degrees centigrade. And of course, then protein vaccine and all these things, which is not. So this is 2 vaccine, and this is the mechanism of action for these 2 vaccines right now. So credible when the vaccine, and we'll see how this going. And we know that we have to take 2 doses. One is day 0 and 21st day for AstraZeneca, and for Pfizer, you have to take 2 doses, 0 and 28 days at the place of 21 days. So these are the different booster dose timings for these 2 vaccines. And data shows it's very promising. So hopefully it will be very, very promising. But the point again here, there are 2 points here now. Of course, you can neutralize using the vaccine. But if somebody is infected already, have compromised lung, and we are listening each and every single day that people are dying because of multiple organ failure as well, not only the lung or the respiratory failure. So why this is like there is multiple organ failure because of this infection of this virus. So what happening in fact when this virus is going and it's triggering a strong reaction, of course, and then killing the lung cells and making the scar of the lung cells, so a lot of cell debris and other things are triggering. So when the cell debris are there, they are going and clumping. Small blood vessels are getting clogged. Blood supplies are getting hampered. So patient may get a stroke, a heart attack, kidney problem, liver problem. So those are the problems. So important is somebody is already infected and having problem. So this vaccine may not work. The only thing may work is the traditional way of treatment, like we are using dexamethasone or steroids and all these things. But for those patients, still the mesenchymal stem cell is the best option. And then secondly, even we are seeing nowadays and listening and seeing the patient that when the patient are rescued from and coming out from the ICU, still they have compromised lung and multiple organ problems. So, and damaged organs. So how to manage those damaged organs? So again, to manage those compromised organs, that is the post-COVID effect. I think the most easiest way to manage using the stem cell treatment, that is mesenchymal stem cell, because it is well known to manage the compromised organ. So the combination of both is, I think, one of the best way to manage this particular pandemic. So let's. So I'm at the last of my slide and talk, and I think I am very much within the time, hopefully. So we treated, as I told, that we treated very severe patient who was under coma for 60 days because of COVID infection, and again. We are very thankful to US FDA. They allowed us to treat that so severe patient who was almost on the deathbed. So we were on the news, all over the news channels and all these things. So I'm going to show you.
A San Diego-based stem cell research institute believes its discovery may have saved the life of a COVID patient on death's doorstep. Our ABC 10 News reporter John Horn explains why the new treatment could be game-changing and while we await a vaccine.
He was having a stroke, he was under dialysis, liver function was declining.
The prognosis grim for this 53-year-old COVID patient deteriorating in a New Jersey hospital. The man fell into a coma that would last nearly 60 days.
Nothing was working, in fact, like plasma therapy and all the classical kind of treatment.
That's when San Diego doctor Anand Srivastava and his team at GIOSTAR sprung into action. GIOSTAR is an international stem cell research firm based in the Golden Triangle. It got special clearance from the FDA to infuse the 53-year-old man with mesenchymal stem cells taken from an umbilical cord.
Slowly, his renal and liver function came towards the normal. He came out from the intubation, and now he's talking.
Srivastava says it took about 3 weeks for the man to recover. GIOSTAR interviewed the patient's family, keeping identities confidential due to privacy laws.
Basically, we had no hopes for him, but it turned around.
I feel so happy to say, because he has a daughter and wife, of course.
Srivastava says this kind of treatment could be key in helping COVID patients survive until a vaccine arrives to protect people from infection. John Horn, ABC 10 News. GIOSTAR is planning to conduct a double-blind study for the treatment to make sure that its conclusions are correct. That study is expected to take about 3 months.
Please ask if you may have any question.
Thank you, Dr. Srivastava, for your wonderful presentation. And we have been enlightened with so many facts regarding COVID-19. Though I don't have much exposure in stem cell research, but I have 2 basic questions. Like we know that patients who are suffering with diabetes or having high blood pressure, we have heard that COVID complications, it is being escalated.
You're right.
And does the association between COVID-19 and diabetes differ with the different types of diabetes? This is one question. And the second question is, do anti-diabetic drugs have an impact on disease progression?
Okay, wonderful. So, so diabetes is one of the thing, and this is in fact we are seeing almost every single patient who are suffering with diabetes, and generally type 2 diabetes, because type 1 diabetes is in the kids. Okay, and so what does diabetes do? Diabetes, in fact, creates a big problem for energy production utilizing the glucose, and because of diabetes there are a lot of other secondary problems, and we say underlying problem, health problem, and not only for diabetes, any underlying problem creating a big problem for those people who are suffering with COVID-19. So when COVID infection is there, what it does, it goes and hampers it binds the epithelial cell of the lung and hampers the exchange of the oxygen, and means the energy metabolism finally. And diabetes has the same problem. The diabetes also creates the problem in the energy metabolism because of the utilization of the glucose and oxidative phosphorylation and all these things, and mitochondrial problem. So the person who is suffering from the diabetes and going to get the COVID-19, so diabetes and COVID-19 together does not only form 2 + 2 = 4. It synergizes the problem multifold because of the diabetes. And I would like to say one thing here, that we know that the young people does not get too much problem with the COVID. Yes, they get infected, they feel little bit problem or coughing or something, but they really don't have those kind of problem related to those people who has underlying situations or old people maybe. Why it is? Because the young people has a lot of stem cells in their body to fight this. And secondly, this particular virus does not affect the mesenchymal stem cell, because mesenchymal stem cell does not have ACT, that particular receptor, that is AC2 receptor. Okay, so that is the main point. So that's the diabetes part. And your second question was that is it going to affect different kind of diabetes? Is that? Yeah. So
anti-diabetic drugs, they have any impact on this?
Okay, so it depends again, like anti-diabetic drugs like metformin or something, if you are going to give. So the point is, anti-diabetic drugs, if you give, so you are going to somehow, if you managing the diabetes using anti-diabetic drug or something. So I very mixed reaction I can tell at the data what I have with the patients, that most of the time anti-diabetic drugs, when the person having diabetes and going through COVID-19 infection, those helps, because they can manage the diabetes through anti-diabetic drug. And then at the same time, you see, the problem is like with the diabetes people, what is the classical treatment? Dexamethasone, remdesivir, and if you are in India, you get antibiotic also to manage the secondary infection to the lung. So what happens, that dexamethasone increases the blood sugar, and diabetic person already has the problem of managing the blood sugar. So in that case, it is so difficult to give dexamethasone, and that is very important to manage the cytokine storm of the COVID-19 patient. So, in fact, it's a very fine balance. In general, if you can balance probably better way, yes, diabetes drug may help.
Thank you, sir, for your nice presentation. And now for question and answer session, I will request Dr. Anand Primrajan. He's the moderator. Now over to Dr. Anand Primrajan.
Thank you, Dr. Srivastava. It was, in fact, an enlightening and presentation because you started with basics, what is a stem cell, so even a layman can understand. Then you move ahead with the Human Genome Project, stem cells, and you talked about the papers published in the October 2020, and you have updated with what is going to come, right? So you compared both the Pfizer and AstraZeneca vaccine, which was, of course, a very new, and you informed us in a very subtle way that we are able to understand even this minute detail. Even a layman who knows the biology a little bit can understand. And you have also spoken about the how or what are the precautions we can take. So that means when you spoke about the energy management and other things, so in India we are all doing a lot of yoga and other things. So indirectly we can understand that there are so many other things which can be done. So there are some questions which have come in the chat box. So first question is from Mr. Krishnamurti Kannan, that is MSC, can it be called a stem cell?
Okay, so that's the question.
Yes, sir. And another one is, sir, as MSC have benefited effect to immunomodulation, but most of these findings are in vitro, and we all are aware that MSC uses LL37, and this molecule is also associated with autoimmune disorders. So, is there any consequence related autoimmune conditions in case of COVID-19 finding? So this is the question, sir.
Okay, good. So first question, Professor Krishnamurti asked about to question whether this, we can say it is stem cell or not. Okay. Yes, there's a big debate going on. And again, I personally say, you see, I say it is a brain massage. So according to the definition of stem cell, that it can give same kind of cells when proliferate, and if you give to signals, it may differentiate to different kind of organs. This is not a certainly we cannot say it is a pluripotent stem cell. There are different kind of stem cell, multipotent, unipotent, pluripotent, so there are a lot of definition. So if we see this definition giving same kind of cell, and if given a specific signals can differentiate to different kind of cells, you can define this as a stem cell. But again, there's a lot of debate going on, and this is the point. Sometime I feel that how to really, we before this COVID-19, we were talking a lot of science and debating a lot of things. This is not, this is this, this is this. As we know everything. Certainly, we don't know everything. That COVID-19 told very well to us, and that we struggled a lot, and almost millions of the people died. So that is my answer about the stem cell. Is it a stem cell or not a stem cell? The point it behaves like a stem cell, or whatever you try to say, but this is very important cell which really helps in lot of situations. Secondly, if you that question that sometime some report tells it may create autoimmunity or something. So in case of COVID-19, we do not have long-term study. We just started 3-4 months, I think 6 months back, and now we are treating and collecting the data. The most important point is that we rescued almost all patients who were very severely sick or affected with COVID-19. And at this time point, when we don't know what is the answer even, and if we can save some life using something like yoga, like respiration, like pranayam, like Ayurvedic medicine, like turmeric powder, like Chyawanprash or Triphala, okay, all are good. But in long term, yes, we have to know whether it is going to really create some other kind of problem. But point is here that this is really working and nicely. And to those patients who already gone through classical treatment till plasma therapy, starting from dexamethasone, remdesivir, plasma therapy, nothing working, then only we can use this. Because FDA only allows when the patient already tried everything and nothing is working. So that's the point here.
Thank you very much, sir. So another question from Seetal is several cases of people infected with COVID-19 have been reported to catch the infection again, and deaths also have been reported. With the primary infection, antibodies against the S protein should be formed. So how is the secondary infection still so severe? And how is the vaccine going to be any different or solve this problem? This is a question from Seetal.
In fact, she asked very nice question. Every single person is talking about that. Okay. And I personally do not want to undermine this vaccine. As I told very well, I told very clearly that this is opening a entire new era. Like we are going to give every single person a kind of gene therapy, basically, which was all continuously stopped by entire world. Even US FDA, just name the regulatory agencies of entire world. Nobody allowed it. Okay. So the point is putting that, is it not possible if you take this vaccine and again you make it infection? Yes, it is very much possible because we don't know at this time point. We just 2 days ago, we started giving the vaccine to the people. And it is also correct that several people who got COVID-19 infection, few of them again got the infection, and those infections were even more severe than previous one. But again, those are, I think, exceptional case. And we have to study those cases because it is also possible that those particular people who got reinfection of the COVID may have some kind of underlying situations which we may not be knowing or may not be reported. So there are several if and buts, but she's right. We don't know right now.
Thank you, sir. And another question which is asked by the Khushi Srivastava, and the first question also was from her when she asked about the immunomodulation. Now she is asking about before COVID-19 pandemic, why there was a restriction on usage of adenovirus and why they have approved now?
That is very good question, in fact. So there are two answers. So, okay, I'm going to talk scientific answers anyway. So, where this is so severe situation, the pandemic, and several people, more than millions of people died, in fact. This is the saddest part of this situation. And what to do then in that case? Okay, making a vaccine going through classical way takes a lot of time, almost 10 years, 9 to 10 years. And when there is a war, and this is a war, in fact, enemy is at the door. So you have to fight with that enemy, whatever you have. You are not going to see what kind of weapon you have in your hand. So this is the situation. So that is the reason they allowed this RNA and DNA and RNA vaccine, and also allowed the adenovirus. Of course, it is chimpanzee virus, and it is well known that it does not harm to human beings because this virus from chimpanzee. And so But again, she asked a very good question. Why they did not allow it? Because they are always worried if that virus goes and creates some kind of problems, okay, to human being. But again, the research document their data, which they did already, and checked on thousands of the people with double-blind trial. They showed it is quite safe. So now it is safe, and we are suffering with biggest problem of the entire century. So yes, this is the big fight.
Thank you, sir. And another question is that how COVID is related to blood pressure and blood pressure patients.
How COVID is affecting or creating problems?
Yeah, affecting. It's a comorbid situation. So they are asking about how it is related to blood pressure, high blood pressure patients.
Okay, very good. So again, we have to first understand one point here, that COVID is very severely affecting the lung. What is the purpose of the lung? Lung is the lifeline for our body from the external atmosphere environment. Without lung, of course, every organ is important, but exchange of the oxygen and then finally taking that oxygen towards the entire body and generate the energy, lung is now compromised. Blood flow is needed more and more to oxygenate your body. And then somebody already has the problem of the blood pressure and all these things. So he's going to have more problem because now lung is compromised, oxygen exchange is not there, then energy metabolism is hampered, then there is a scar in the lung, the dead cells are coming in the blood circulation. Those dead cells are clumping, maybe blocking the narrow capillaries of blood vessels, creating another problem. And then if it is blocking the nephrons, glomerulus, then again the kidney problem, filtration problem. So it's a lot of secondary problems to those people who are suffering with, again, blood pressure or any kind of underlying situation, because lung is very important organ to supply the lifeline to our body. All other things come second.
Sir, another question from Khushi Srivastava. I am reading the question. Continuation to the previous question, as you have stated that Oxford vaccine works on genetic material, which is a stable molecule, but we have that there is a second wave of COVID-19 and that is more dangerous. So is there any chance that as we are interfering with genetic material, is the reason for development of more dangerous vaccine, more dangerous virus?
These are very hypothetical question, in fact, because we do not know. And the second wave of COVID is not because of some mutation in the COVID. Just we heard that in UK they got some different kind of or some mutation in S protein of the virus, and again another debate or discussion you can start, that okay, mutation means what? It is also possible that that particular mutation which is on S protein may not bind to ACE receptor. Okay, so that is also very possible. So virus may not create any problem, but we don't know right now. So point is that after giving this vaccine, and this DNA particularly, she's talking about Oxford vaccine. So this vaccine is going to translate a specific protein through mRNA transcription. So hopefully, we hope for better outcome. And they already tested thousands of the people. So the data shows that they get 95% people rescued So that's quite good, in fact. So there is no reason right now, there is no reason to believe that it is going to not work or it is going to create more problem in the future. There is no reason to believe that because data is very good and not in 1 or 2, 30,000-40,000 people, I think.
So last question, sir, and with this we will be winding up because sir, the last question is, in a family, one person is affected by COVID, whereas all the other 4 people are not affected. Why is it so?
This is very, again, I'm telling my own experiences related to this, but herd immunity, you know already that there may be some infection and they develop the antibody for that. And I have seen that people who in one family get affected and young people just get some infection a little bit, or if they go for the PCR test or antibody test, they get positive antibody test and PCR test, but they do not feel any problem or symptoms of COVID. So this is very much possible to develop a herd immunity because of the close proximity of a COVID infected person. So a lot of different things are going on. And that's what I think India is doing very good. Now 0.1% people are going in the severe situation like dying or something, but most of the people are recovering. So I think it is because of the herd immunity.
Thank you very much, sir. So over to Nilendra, madam. Would you like to say something?
Thank you so much, Dr. Srivastava. We are really very lucky to get you here, and we are thankful that you have spared your valuable time, and we are really enlightened for so many things regarding COVID-19. Thank you once again. Thank you.
Creating a positive and significant impact for human race is our primary goal. From research to treatment is our purpose.